Hi, my name is Daniel, and today we are going to be doing a demonstration of bleeding and shock control management. So here is our patient. You're going to arrive on scene, assuming that the patient is conscious, just to make things easy. We're going to say he has a direct wound right here where this blue tape is, okay? Now, a lot of the times your patients aren't going to be perfectly flat. They're going to be sitting somewhere or in a weird position. So first thing, of course, you're going to want to do is have your PPE on. You're going to want your gloves, your mask, and depending on how extensive the bleeding is, and in this scenario it's going to be pretty heavy, you're going to want a gown, eyewear, anything to make sure that the blood does not get you infected. So you arrive on scene, you see and locate where the wounds are. Sometimes it's more than one. First thing you want to do is get some gauze and apply pressure directly to the wound. You're going to want to push down, and usually you can feel whether it's still bleeding. You're going to see it soaking up. Now you're not going to replace the gauze, you're going to leave it on, and then you're going to unroll some roll gauze and wrap it around. You're going to want this as tight as possible. If it's still not stopped, then you're going to want to apply a tourniquet. And since we don't have one, we're going to do a makeshift tourniquet. So there's not enough room to do it here, but you're going to want to do it 2 inches from the side of the wound, up from the side of the wound. You're not going to want to apply it to any joint areas. I want to do it at the elbow. You want to make sure, let's say the wound is right here, it's going to be like right here, a little bit up. So we have our makeshift tourniquet. You're going to want to start from the bottom, go up, tight as possible. Then you're going to want to do something hard, some sort of bar, so that you can tighten the tourniquet. You're going to place it here, you tie your knot, and then makeshift knot, and then twice underneath. You're going to want to make sure that's really secure. And then when you need to tighten it, you tighten the bar by twisting it. Now, it's supposed to be tight enough where you don't feel a pulse anymore, trying to stop that bleeding. And you should be able to check the pedal pulse. If you feel nothing, you're good. However, a lot of the times, the patient, from all that blood loss, will start going into shock. So, first thing you want to do is lay them flat. Sometimes you will also want to elevate the limb above the heart to slow down the bleeding. Oh, forgot to mention, when you have the tourniquet applied, you want to make sure that you write the exact time that you applied the tourniquet. If it's not bleeding if it hasn't stopped bleeding after the first tourniquet applied, you apply another one above it and write your time that you applied it then too. The doctors need to know that. So, you've laid your patient flat, the limb is elevated. We're going to apply 15 milliliters or 15 liters of high flow oxygen via a non-rebreather mask for the patient. And then we are going to make sure that the patient, who's likely going to be feeling cold if they're in shock, is warm. So we want to keep their body warm. So you can add a little blanket or something. If that's not enough, in the ambulance, you can turn on the heat as high as possible and try and make them comfortable. And this is provided that your backup is already here and you're probably working with them, maybe an ALS unit. And then you transport your patient as soon as possible. You're going to want to get this done, preferably within 10 minutes or less. And that's it.